All right, hey guys, welcome to our webinar. As you may be able to tell, this webinar is going to be all about cycling injuries. Next slide, please. All right, so today's webinar is powered by Human Integrated Performance. And on today's agenda, we're going to start off with some true and false questions, get some participation in the chat, and then we're going to go into our 3 injuries: pudendal neuropathy, de Quervain's tendinosynovitis, and cyclist palsy. Then we'll tell you what to do treatment-wise and prevention-wise, and then we'll end off with some open time to ask some questions. Today's speakers include our 2 physiotherapists, Sarah and Jenna, as well as our kinesiologist, Madeline, and myself, Sophia, the kinesiology student. All right, so our first true or false is the pudendal nerve is located in the foot. Type in the chat what you guys think, and we'll give you some time to answer. Okay, I got some falses in here. All right, next slide. So the answer is false. Good job, everyone. The pudendal nerve is actually located in the perineum or the saddle area. We'll go over this when we get to pudendal neuropathy. And then we have another true or false. So the true or false is you can get tendon inflammation from holding bike handles over a long period of time. What do you guys think? Have a false in here. Someone said true as well. And that is correct. It is true. So prolonged repetitive activities such as cycling are a common cause of tendon inflammation. And we'll also go over this later on. So I'm going to pass it over to Sarah to get started.
Hi guys, my name is Sarah. I'm one of the physios here at Human Integrated Performance, and I specialize in pelvic physiotherapy. So our first injury that we're going to talk about is called pudendal neuropathy. So just a bit of anatomy to start off for you. The pudendal nerve is part of the lumbosacral plexus. It comes out kind of at the bottom of your spine. So it's S2 to S4, kind of around your tailbone area. And it provides innervation to that saddle area, so the bottom of your pelvis and your genitals. It's really important for bowel and bladder control and for sexual function too. And it does provide some sensation kind of to the buttocks and saddle area. So you can kind of see in here, it shoots out underneath all these muscles and then comes around under the sit bone area. So the general cause of pudendal neuropathy when you're a cyclist is just from compression of the nerve from prolonged sitting on the seat. So if you can see, the nerve comes out here and then kind of loops underneath this bone, that's your sit bone. And when you spend a long time sitting on the saddle, it can compress that nerve. And then what you get is burning, tingling, or numbing pain, kind of in the distribution of the pudendal nerve, so in the pelvis or genital area. And it does get worse with sitting.
All right, hi guys, my name's Jenna. I'm another one of the physios here at Human Integrated Performance. So I'm going to talk to you guys a little bit about de Quervain's tendinosynovitis. So just to talk first about kind of the anatomy of what happens in this injury. Usually you'll get pain kind of around the thumb side of your wrist. And what happens is it's caused by holding onto your bike handles for a really long time. So it's more of a repetitive overuse type of injury. And as you saw in the previous slide, those 2 tendons kind of come up along the side of your forearm here into your thumb. There's 2 tendons, your extensor pollicis brevis and your abductor pollicis longus, and they kind of travel together in that area. And then there's actually a sheath over top of it that combines the 2 tendons, and that's sort of the area where you get that pain and inflammation when you're holding on to your bike handles for a really long time. So the main symptoms that you'll get is just pain kind of in this area, as well as crepitus. All that means is that it makes sometimes some kind of like creaking sound, or sometimes you'll get a clicking or like a popping sensation in that area. And it usually is worse like the longer that you hold the position, or if you're doing repetitive movements either with your thumb or with your wrist.
Right. Hi, everyone. My name is Madeline. I'm a kinesiologist here at Human Integrated Performance, and I'm also an avid cycler myself. I'm going to be talking about cyclist palsy, which is essentially an overuse injury that affects your hands and your fingers. Now, essentially, a bit of background anatomy information. The nerve that's affected during cyclist palsy is your ulnar nerve. So essentially, it travels from up your neck all the way down the back of your arm and then down into your pinky finger and your ring finger. So these last two digits here. Now, essentially, cyclist palsy can occur when the pressure exerted on your hands because of the positioning on the handlebars basically irritates this ulnar nerve. So when you are in what's called a hyperextended position in your wrist, so basically your wrists are coming back this way, aka when you're on your bike and you're in that position, it can affect that ulnar nerve. It can irritate it and basically result in sometimes some numbness, some tingling, some weakness, and some cramping in that pinky and that ring finger. So ultimately just not a great feeling that you're going to go through. And one of the things that can really, because biking sometimes can be for quite long distances, over 25 kilometers, the positioning of your wrists on those handlebars can really be greatly affected. And those nerves can really get compressed and irritated quite easily. So it's kind of a combination of long, like 25-kilometer plus bike rides, especially if you're going through mountainous terrain where there's a lot of bouncing and a lot of jarring on your wrists, on your handlebars, that can increase the risk for it. And also just like improper ergonomic setup of your bike can all lead to this numbness, tingling, weakness, loss of motor function in that pinky finger and ring finger.
Hi guys, it's Sarah again. So we're going to talk a little bit about treatment of these conditions and what you can do to prevent them. So for pudendal neuropathy, the main thing to think about is if you can just make the seat a little bit more padded, that's going to help decrease compression on the nerve. So even just using a seat cushion or alternating between sitting and standing when you're pedaling can help just decrease the compression on that nerve. The other way to treat it is actually through pelvic floor physio. So that's why it's really important that you see a pelvic floor physio if you do have any, especially numbness or tingling or issues with the saddle area, just to being sure that you're cleared of any red flags, and also get some specific exercises to you that can help relax your pelvic floor. I'm going to show you a couple that are just general that you can start off with, but again, it's really important that you actually see a pelvic physio to teach you these. So I'm just going to show you on the floor here. So the first one that you can do, I'm just going to make sure I can see myself. Okay, so the first thing you can do is called a cobra. This is going to help stretch your back out and kind of go in reverse of what you usually do when you're cycling. So when you're cycling, you usually flex like this, but you want to be more extended to kind of treat the back and pelvic floor while I'm cycling. So the cobra exercise is basically you're just lying on your stomach like this, and you're going to push up to extend your back. The closer that your hands are to your face, the more extension you're going to get. If you find that you're lifting off really early, you can just put your hands farther away and extend your elbows like that, and you're not going to get so much lift. So the farther your hands go, the less intense it is. If you bring it closer, you get more of extension. The next exercise you can do is a wide leg bridge. This is going to help strengthen your glutes, and also the wide leg position is going to help relax your pelvic floor a little bit. So if you just lie on your back, instead of having your knees right together, you're going to put your feet a little bit farther apart. Think you're squeezing your glutes in here to just lift up off the ground. It doesn't matter too much how high you go. The more important thing is that you're actually squeezing in your glutes here and not feeling so much in your quads or in your hamstrings. Physios can definitely help you with positioning and that kind of thing if you need to change it so that you feel it more in your glutes.
Okay, so for de Quervain's, for the start of treatment, with hand and wrist injuries, we do have to be a little bit careful and sometimes a little bit cautious, just because of the anatomy in your hand tends to be quite reactive sometimes if we go too hard, too fast. So sometimes you might need to modify your grip a little bit on the handlebars or try to like change your positions throughout your cycling, depending how long of a trip that you're going on, as kind of a first thing, just to help manage with the pain. And then the first thing you're gonna want to do after that is starting a strengthening program and starting to stretch out those tendons. So the two tendons I talked about before, one of them helps with kind of, what's the best way to show this? Kind of this movement of the thumb. And then one of them helps more so with this movement of the thumb. Sorry, I know that's a little bit difficult to see through the camera there. So you can start off even with doing some isometrics. So that just means using your other hand to apply some resistance. So instead of like moving through the range of motion, you're just going to apply a little bit of push here with your other hand so that you're getting the activation of that muscle, but not moving into the positions and the movements that might start to aggravate and cause pain. So that can be a first one to start with, is just kind of pushing into your own hand, holding for a couple seconds, and then you should feel these muscles starting to work right here. And then you can also do that for the other movement, more of this, kind of bringing your thumb towards you, again, using your other hand to kind of push there. Another thing you can do is once you start to get a little bit better, you can add some resistance onto there. So you can use a TheraBand. Another thing that's really helpful is just like an elastic band. This is just a hair elastic, and you can put that around your hand basically, and then try to do the same movements as I showed before, just to add a little bit of resistance on there. You'll also want to stretch out the tendons as well. Again, you want to be a little bit careful with this because it can be quite reactive and cause a little bit of pain. So you're going to want to stretch it out. You're basically going to hold your thumb with your other fingers, and then you're going to try to like bring your thumb away from the rest of your hand like so, and you'll feel like a nice stretch kind of in that area. But again, just be a little bit careful. You don't want to go to the point of pain. You want to stop right before that just to get the tendons moving a little bit. Other things that you can try is more of an adjunct kind of therapy. Ultrasound can be helpful. Therapeutic ultrasound, as you see in one of the photos there, can help with like breaking up the cycle of inflammation, as well as K-taping sometimes, as you can see in the other photo there. Your physio or your kinesiologist can apply some tape onto kind of the top of your thumb here and around your wrist to provide a little bit of extra support and a little bit of like proprioceptive feedback, so that when you start to move your hand into those aggravating positions, it's kind of a little bit of a reminder to you. And the tape can be helpful, especially like if you're trying to just like get through your next ride, or if you have a race or something coming up and you just need to kind of help with the symptoms and get through that. But the main kind of long-term thing will be seeing a physio and getting started on your exercise program.
Alrighty, and as I kind of alluded to before, cyclist palsy can be really quite aggravated when you're holding your wrists in this hyperextended position for quite a long period of time. So the first thing we want to do to avoid or to help treat cyclist palsy is to basically avoid wrist hyperextension. It's kind of easier said than done, but you can always practice by going on shorter rides around your neighborhood or around a small area or a small park. Just being super mindful of your wrist positioning on the handlebars. So just as a reminder, we do not want to go like this. We kind of want to focus on keeping our forearm and our wrist in a nice straight line so that we're not putting that pressure through the back of our wrist in that area. And of course, it's also good to change hand position frequently. So just make sure that, you know, if you do tend to fall into that wrist hyperextension, even if you're consciously trying not to, just to try and move your wrist around, even if you have a little break on a flat, just practice rotating one wrist, rotating the other, and then readjusting. Hopefully every like 5 to 7 kilometers or so, try and give it a change up, just so you're not falling into that hyperextended position for a prolonged period of time. And then of course, patting your handlebars is a great idea, just so that when you are maintaining a healthy wrist position, it's also comfortable. I find for me personally, sometimes the hyperextension position is quite comfortable. So I think it's a good idea to look into padded handlebars or some sort of padding on the handlebars so that it is comfortable in that kind of straight line position. And then in terms of strengthening, there's also a couple solutions. So by strengthening our grip, we can kind of reduce that reliance on falling into that hyperextension position. So you can still go on those long bike rides without putting yourself at risk. Now, this is called AveraGrip therapy. It's something that we sell here at Human Integrated Performance, but don't worry, I will give you a different solution for now after. But basically, this is just a fancy grip trainer where you can squeeze either individual fingers or you can squeeze them all at once. And as I said, helps focus on that grip therapy, making sure you're nice and strong while in that straight position. If you don't have one of these, or if you don't want to buy one, I think just about everyone has a little stress ball around their house that they got from an open house or something random. And again, same thing, just practice squeezing, feeling those muscles through and those tendons through your wrist and your hand, getting nice and strong, and then relax. So that'll be the same thing, keep your wrist nice and straight will help with that. Another part of your body that you can strengthen is your core. So a stronger core will basically mean that you're not gonna sink into the handlebars. You can keep yourself up nice and straight. And as a result, you're not gonna feel the need to lean into the handlebars as much. And of course, when you lean in, that means you're gonna have more of the hyperextension position. And I don't think you guys need me to tell another time about that. But one of my favorite core exercises is doing a dead bug. I like anything where you can lie on the ground basically, but it's a great way to strengthen that core. And then finally, one thing is just if you're not entirely sure about your bike setup, just hit up a bike shop. There's tons of friendly folks in there that are willing to go out there and help you and make sure that everything is ergonomically set up so you're ready for success and you're not going to get any numbness or tingling in your fingers.
Yeah, so general message for the treatment is make sure that you see a physio if you have any of these injuries. It's great to start with these exercises generally, but you definitely need some individualized treatment and feedback, especially if these injuries have been kind of plaguing you for a while.
All right, thanks everyone for all that great information. So we're just gonna go over a quick little review over what we just talked about. So starting off with pudendal neuropathy, this occurs when the pudendal nerve is compressed, usually from applying pressure on the nerve for a long period of time, which usually happens when you're sitting on your bike seat for a long time. Symptoms may include tingling, numbness, or pain in this area, which are aggravated when sitting. And in order to help with these symptoms, you may use a seat cushion or break up the periods you spend sitting, as well as performing some pelvic floor relaxation exercises. Next, we talked about de Quervain's tendinosynovitis, which is an inflammation of the tendons that insert into your thumb. This can occur from repetitive gripping motions in this pain, while holding onto your bike's handlebars. So for this, you want to stretch and strengthen the thumb to help with your symptoms. And then lastly, we talked about cyclist palsy, which is an irritation of the ulnar nerve at your wrist. This, along with other nerve injuries, can feel like tingling or numbness, as well as you may feel weakness in your hand. So in order to help with this, you may modify your seat height or tires to relieve that pressure on your wrist when you're cycling. So what's next? It's important to see a physio or a chiro to help treat your symptoms. Our providers are always taking new patients and would be more than happy to help you return back to cycling or any of the other activities you love to do. So call the clinic and book an appointment with us. And now we're just going to open it up for some questions. I see we've been getting lots in the chat throughout, so I'm just going to read them out and then throw them at our presenters. So the first one is for Sarah or anyone who would like to take it. It's, what if I don't have the option to take breaks, like during a long race?
You want to take that one, Jenna?
Sure. Yeah, I can try. You can jump in. I'm not sure which injury this was referring to, but I guess for any of them, it could be applicable if you're not able to like modify or take a break. What I would try to do rather than like stopping and taking a break, like I would try to like do some standing up and some sitting down. Try to like move your hands around the handlebars as much as you can so that you're not like in one position the whole time. Um, and then like, yeah, just try to modify your posture. So go up and stand up for a little bit, sit down for a little bit, try to modify your grip as much as you can, basically, to be able to get through the race. But yeah, it's definitely difficult if you're in kind of a longer race, but those are times too when like taping can help, especially if you're talking more about like the hand injuries. I don't know if anyone has anything else to add, or you might want to try to like find a seat if you're talking more about the pudendal neuropathy that is a little bit more comfortable for you.
Yeah, I agree with all that. The other thing to think about too is if you're riding for a long time and you can't modify, that's a good time to make sure that your bike is really set up well. If you're going to go for a long ride and your bike isn't set up optimally for you, then you're going to have a worse time too. The other thing too is if you have a race coming up or something that requires you to perform and not take breaks, that's a good thing to talk to your physio about. Sometimes it's fine to just like do the race, you feel a bit worse after, but it's important and we'll say, yeah, go for it. But sometimes if it's not worth the pain or worth like having an increase in symptoms, it's often like you might have to miss that one for the sake of going for something that's more important. So sometimes weighing the pros and cons of that kind of thing with your physio can be helpful too.
Good. The next one is going to be for Sarah, our pelvic physio. So this one is, are pelvic tilts on a ball a good exercise to relax the pelvic floor?
Yeah, that's a good question. It kind of depends what would be causing any tension in your pelvic floor. That's why it's really good to see a pelvic physio, because you kind of have to go up the chain and find the cause. Doing pelvic tilts can be good for stretching and moving. So if your pelvic floor is really stiff because say your lower back is really stiff, so your pelvis isn't moving, but getting it moving on a ball would help relieve the stiffness just because it's not moving, that would be helpful. If it's stiff because there's weakness or some kind of chain reaction from your hip musculature, your core, your back is really weak, or you have a history of bowel or bladder issues, that kind of thing, pregnancy is involved, sometimes just doing pelvic tilts on the ball isn't enough and needs some other stuff to kind of add on to do some relaxing of the pelvic floor.
And this last question in the chat, I'm going to throw it over to Maddie, our kinesiologist. It is, how long do I need to keep the K-tape on for?
So you can really keep K-tape on as long as it'll stick, essentially. That's kind of a bit of a game that we're playing with it. Sometimes it'll want to stick on your skin if it's particularly dry and clean and there's no kind of debris or dirt on your arm. It can stick for, I'd say, at least like 36 hours or so. That's on a good time, but it will start to lose its effectiveness. So after those first couple hours, it'll start to, start to loosen up, especially if it's going to be on your hand or your wrist. Obviously, we're busy, we're active people, and we need our hands for our daily actions. So the more you do use your hands, and the more you if you're, say, washing your hands, if you need to go take a shower, that's ultimately going to start to degrade the tape off, and it's going to it's not going to stick. So if you find it's peeling off, or if it's no longer kind of feeling tight, or just it's essentially, if it's falling off, that's a good indication that it's time to take it off. Of course, if there's any irritation as well, that's also a good sign to take it off and then discuss with your physio after, maybe find a different solution instead of the tape. But yeah, you want to, if it's still feeling nice and secure on your skin, if it's feeling nice and tight, there's no like air bubbles, and if you feel supported with the K-tape, definitely try and keep it on as long as possible. Linking back to that question with doing it during a race, try to get the tape applied as close to the race as possible. That'll mean it's the most effective during the race and during those long cycling rides. So just keep that in mind as you're planning out. Don't go like a week before and get tape done and think it'll be ready for a couple of days. Try and keep that time window as small as possible.
Awesome. Thanks, Maddie. That was a great answer. Next slide. So that was the end of our presentation. Hopefully we were able to teach you something new and as well answer any of the questions you had. If you do have any more questions or concerns, or if you would like to book an appointment, you can always give us a call at the clinic, or you can email us as well. We'd be happy to answer you. And then as well, we also included Sarah and Jenna's emails on the screen as well. So if you have any like physio related questions, you can send those over to them as well. We have all our social media on there, and we'd love it if you connected. So thank you so much for joining us today, and we hope you have a wonderful day.